Hi there, my name is Brooke Rossi, and I am a reproductive endocrinologist at Ohio Reproductive Medicine in Columbus, Ohio. We are celebrating Pride Month with our patients. We have many patients who are members of the LGBTQ community, and we work really hard to help serve them the best that we can. I just want to spend a couple minutes talking about some different options for our patients. One of the more common group of patients we see are either two egg providers, two women, or two members of the LGBTQ community who are interested in doing donor insemination. That is a relatively straightforward process and is very common. It's been well-established process for many, many years. Often that first visit is getting a medical history to understand if there's any risk for infertility. Often these patients have never attempted to get pregnant before. However, we still will do some baseline testing to understand if they have any risk of infertility. That may include a blood work evaluation, including hormones. It may include a pelvic ultrasound, or maybe even a hysterosalpingogram, which is a fallopian tube test. Often these patients don't need any infertility medications because they usually don't have infertility. They just simply need to be exposed to sperm on their most fertile day of the cycle. The procedure that is performed is something called an intrauterine insemination. Sometimes it's also called IUI, or even sometimes called TDI. And what that means is that the sperm is purchased from a sperm bank, and it's most commonly purchased in an anonymous sperm from a sperm bank, although it is possible occasionally to use sperm from a directed donor or somebody that you know. That sperm, which is often frozen, is then thawed and then very easily put into the uterus on that patient's most fertile day of their cycle. The chance of getting pregnant is actually quite good, and many of our patients have babies in this way. There are also some patients who present with their partner who are interested in doing something called reciprocal IVF. This would be an option for a couple in which both patients had ovaries and a uterus. And in that situation, we would have one person go through an in vitro fertilization cycle, and we would collect eggs. Those eggs would then be fertilized with sperm, and that embryo or that fertilized egg would then be put into the partner. And that is another great way to build a family. We also take care of patients who are potentially two sperm providers. And if we had this couple, those patients often will need to use an egg donor and also a gestational carrier. Those cycles can be somewhat more complicated, but are done very, very commonly. And again, that is how we help those patients build families as well. Ohio Reproductive Medicine has been working with members of the LGBTQ community for years and years. We really pride ourselves on taking very good care of these patients. Our staff is very open. The physicians and the nurses are very open as well. And we hope to continue to work with this community. Thank you so much, and have a great Pride Month.